Well, thanks to all of y'all for being here. And this is a policy discussion we do once a month on the fourth Wednesday. It's open to everyone. We started it with our leadership training graduates, but then we realized a whole other group of people were interested too. So this is open to everyone. Um, and I appreciate all of y'all being here today. And we talk about different things that are going on either at the state level or at the federal level that have to do with policy and just what would be a way that we can respond to those things in a family driven way. Now, this week, there's been a lot of discussion about autism and some information that's come out at the federal level. And there's been probably everybody's aware of that, a lot of intense um, discussions and feelings and opinions about that. So today we just want to take a step back and say, okay, hey, Nikki, how do we look at this from a family driven perspective? Because we always try to do that at families as allies. And there's no better time to do that than when something's hard or maybe causing a lot of emotions or different people have very different views on it. So that's what we'll be focusing on today. Um, And if you're just getting here, want to introduce yourself in the chat. And some of y'all are saying hi to your friends, which is absolutely wonderful. But please go ahead and introduce yourself. Now, before we start looking at what we're actually going to talk about today, like how to look at this information in a family driven way, is there anything anyone wants to share or things you're thinking about related to this that you want to make sure we all get a chance to talk about? Because this is everybody's discussion. Right. And was everyone aware that it was President Trump made some remarks about autism today, or not today, earlier this week, and announced some initiatives that would happen at the federal level? And then he had that was at a press conference, and Dr. Oz was there, um, HHS Secretary Kennedy was there, and a lot of other people, including families. So, is that something had y'all heard about that, or has anybody heard anything, read anything, or is this new news?
I so I heard that I think they was trying to say that Tylenol might be linked to it. Um
Okay, that there might be an association.
yes, ma'am.
Okay. Anything else that anybody heard or hit you a certain way, or has anybody been looking at it?
I think it's really scary he kind of said that because Tylenol is not just like what is used for, like what they say you can use it for, it's used for other things as well. And if people if people start refusing to take Tylenol because they're like scared because this could cause panic, especially for like people with small children, and it could lead to like longer hospital stays for things that probably could like been solved a little faster at home. I think it's just a lot of confusion that's probably going to start going around again. Like when they said vaccination cause autism, but we haven't found a link to that either. So
You see it as scary and well, you see it as there's a lot of confusion, and it could be scary depending on what people do with the information that was shared.
And I kind of
And
been
when
following it a little bit because um, I've been a couple of autism groups, like for parents and things like that. And there are a lot of people in there having discussions about, people who've had numerous pregnancies and taken Tylenol and have, 3, 4, 5, 6 children, and none of them have a diagnosis, and other people who say they never took Tylenol and they have children with autism. So it's just, and then a couple of people were talking about it more along the lines of what she was saying as far as medical. When you look at people who are pregnant and they're running fever or have some type of infection, they have been told in the past to take Tylenol. But if they refuse it, then you still can have some effects, because then the person stays sick longer, and then that affects the fetus as well. So it's really disheartening without any foundation. And I feel like it's just kind of throwing us in a, almost kind of like when he was saying what you could drink bleach or something for COVID. And I don't know, we're just not in a great place with all of this.
So you felt discouraged?
I did, very much so, because my daughter got a diagnosis much later in life, because she only has a level, because she has a level 1 diagnosis. So primarily her issues are more social, and not really sometimes understanding boundaries or context clues, things like that. But um, I know for certain I'm not a Tylenol person, not for any particular reason other than I've always had headaches, and other things have worked better. But I know I never took any Tylenol before, during, or after being pregnant. So it has to be more than one source. Even if they want to tie it to that, it can't be the only source, because it wouldn't apply for me.
Okay. Any other thoughts? And I see one person in the chat. Somebody said it sounded like for one person, very familiar one, and it was new news. Okay. And we're going to start with looking at the definition of family-driven practice, because we want to frame everything we do through that. But I want to make sure I'm not cutting anybody off who wanted to say something. All right. Now we're getting to that part where I share my screen, and we all know that sometimes I have my challenges, and I announce that every week or every month when we do this, or every time I get online with y'all, which is usually a couple times a month. Okay, let's see. We're going to go to families as allies and our resources, helpful websites and documents. And if we're going to try to look at this through a family-driven lens, we want to know what family-driven means. So I'm just double checking. Is everybody seeing the resources page of families as allies? I am improving. That's one of the best and quickest shares I've done on one of these. Okay. Is everybody now seeing the actual definition? All right. So we're going to hit some highlights. Family-driven means families have the primary role in decisions regarding their children. So I think we can all resonate with that we all want to be at the table and a primary decision maker for our own child. And then as they get older, they can take on that role themselves. But this is what we're going to talk about today, as well. It really affects both things, as well as the policies and procedures governing the well-being of all children. So families as a whole should be at the table in helping inform policies and procedures about the well-being of all children in their community, state, tribe, territory, and nation. So if there's things being decided at the national level, families should be at the table. And they should be at the table for all of these things, but not just these things, at both for their child and the policy level, the strengths, challenges, desired outcomes and goals, and steps needed to achieve those goals. So if there's something about Tylenol that we need to look at, and that's the brand name, but it's acetaminophen. What do families think should be focused on, or do they think that's what should be focused on? Designing, implementing, monitoring, and evaluating services, supports, programs, and systems. So if this is an issue, what do families think? How do they think this should be looked at? Choosing supports, services, and providers who are culturally and linguistically responsive and aware. So that might be looking at, if this is an issue we're going to research, who are those researchers who are going to look at it? And then partnering in decision making at all levels. So anything about this, families should be at the table. And then let's look at the guiding values. Families and youth share and have access to accurate, understandable, and complete information necessary to set goals and to make informed decisions. That's probably one of the most important things with this. Like, what is the information? And I'd encourage everyone to start, and we're going to look at some of this stuff, to think about it's not just the information about what got said about acetaminophen or Tylenol, but it's all the information about what's being said about it, how are people interpreting the information, looking at all that. Okay, families define their family composition and who they want to make decisions. I'm just looking through, let's look at number 5, and number 4 and 5. Families and family-run organizations provide direction for policy decisions that impact funding, supports, and services, including the right of families and youth to have meaningful voice at the individual and policy level. Providers, agencies, and systems take the initiative to change policy and practice from provider-driven to family-driven. Providers, agencies, let's look at 6, and systems embrace family-driven practice by allocating staff, training, support, and resources to adequately fund and sustain family-driven services. So families should be at the table for everything, including deciding how funds should be used for both their individual child and at the policy level. So whatever happens with all this, families should be at the table. Now, nowhere in this does it say that all families have to agree. And that's one thing I just want to put out there. And that I see a lot, being in the role I am with families as allies. Every family should have the opportunity to be at the table. That does not mean, and sometimes we can just sort of assume this, especially, like as a family member, I might think, oh, this is really important and this is how I see it for my child. That doesn't mean that every family is going to see it the way I do. And I just want to bring this up. This doesn't say that just the families that agree with me have to be at the table. It's all families should be at the table, any family who wants to. Okay. All right. Now we're going to look at this might be where I get a little trickier. Hang on just a second. We're going to look at what actually got said. Okay. If I can share. So one thing I'm going to encourage everyone to think about is what do you think, if we're trying to figure out what got said about this by the White House, where do y'all think would be some of the most important places to look? Like, how would we figure that out? Because we've all heard things, we may have listened to things, we may have read things. What would be a good place to start, in your all's opinion, to think, how do we find out what anybody said? Any thoughts? So I'm sipping on my coffee a little bit. What do you think, Karina? You came on camera, so now you're on the spot.
Ooh, I knew I was gonna be put on the spot. Ooh, wow. Let me think about it. 'Cause
Okay.
it's a lot, it's a lot of mixed emotion that goes through my head when it comes down to, certain comments that's being made and you already have families and people in general that have doubts about certain things. And then when the president or other people that they may respect, or maybe a doctor or whatever, make comments and things like that, it have parents to the point to where, okay, if I use this, then this. But I feel like that parents' opinions, I know it matters a great deal. And I feel like it should be a forum open up to where parents can come back and make their opinions on what was said yesterday or what was said this week. Because I mean, these are the parents that's taking the medication and also giving their children the medication, because they always tell you when your child is getting ready to go take a vaccination, give them some Tylenol before they take the vaccination.
Oh, yeah.
That'll stop the, that'll, head off the fever, and things like that. So, I mean, it's a lot of mixed emotions, and I haven't followed the whole entire thing, but I have been looking at it, and I'm just curious how a lot of families do feel about that statement.
Because usually, like, people in charge, the president or other people, if they say things, it can be people are going to have some sort of reaction to it because that's an important person. And also, we're living in an era where we have a president that, and however you feel about him, communicates a lot of different ways. He's on, which is a Truth Social. Took me a minute. I can't keep up with all the social media. So and he used to be on Twitter, what that's now X. So would share a lot of things that way. I think he shares a lot on Truth Social. He's also pretty comfortable just saying what he thinks, and probably more so than other presidents have been. And I'm not saying that as a judgment. It's just like if you were going to put them on a scale. And I think that makes it, and some people may really, really like those things. Some people may really, really not like those things. But it makes it harder to figure out what's the real deal here. And you were getting at, I put you on the spot and you said you're going to keep thinking, but you actually opened up a door to what I want everyone to think about. When you have, okay, this thing out there that people have strong emotional responses to, and they're trying to figure out, and every parent is like, oh, I don't want to do anything to my baby. And I even, I joked with Sam, my son, about this. Like, it makes me, and in a way, I'm being totally goofy, but in a way, I felt this way as a mom. I was like, maybe I should never take Tylenol again. And, I gave birth to him 25 years ago. Like, if I do something, it's going to hurt you, which is crazy. But I think we have that kind of bond with our kids. So I can only imagine if you're in those shoes now. And then, where do you turn for accurate information? So this is one thing I want everyone to think about when we were talking about what are some ways to keep this family driven, is one thing we can start with, because there's all these opinions out there, including some that may be by the president or other people. Like, what is the thing that these people at the federal level who are telling us we're going to look at this, we're going to look more at Tylenol, and what if it could have a relationship to autism? We need to find something that's like, what do they actually agree on? What do they most want us to know? And you know me, I'm a policy geek. So I want y'all to think about this. And I hope I'm pulling up the right thing. Oh, there it is. Okay. This is not from Truth Social. This is not something after the fact. Does anybody know what this is when you see something that looks like this that says it's from a press room for immediate release? Who you contact? What is this thing? And it's on an official government website, Health and Human Services. You know what this is? This is like journalism class. This is a press release.
Okay.
So then, oh, okay. I'm sorry. Is that what you were getting ready to say, Karina?
Yes, ma'am.
I'm sorry, I didn't give you a chance. So this is something, and just to think about with a press release. Okay, first of all, it's in writing. so we can go back to it. And it's probably been a whole bunch of people have probably looked at it and said, yeah, that's okay. That's what we meant to say. And probably all those people that we see talking about this, so President Trump, RFK, Dr. Oz, some other people have looked at this and said, yes, I can sign on to that. Now, that doesn't mean they also don't think other things beyond this, but this is like the official document. So let's just think about it or go through it. And there was an actual press conference too, where they were all in the room and they talked about this. When I looked at that press conference to me seemed to go a fair bit beyond what we have here. And I think part of that was I'll put the link for the press conference in there. I think I saw it pulled up. After we go through this, I would encourage you to watch it for yourselves. And one thing I would encourage you to think about as you're watching it, like with President Trump, I think there's times where he's reading this, which are the things that everybody agreed on. And then there's times where he's saying what he thinks about this. So one thing to think about, if that first principle of family-driven practice is that families have accurate and complete information. What has been written down in a press release that has had several people review it and everyone's agreed on is very different, probably, as far as accurate and complete information. This is probably much more likely to be accurate and complete information than somebody saying, well, this is what I think. Now, if you watch that press conference where all of them, starting with President Trump, talk about this, he will say, I really believe in this. I'm going beyond. I'm not going to wait for the studies. And he has every right to his opinions, but he makes it clear, at least to me when I watched it, that he's sharing things that go beyond this. But these are the things that everyone seems to have agreed on. So let's look at it. All right. And it starts off, this is just giving the data in the first paragraph. And then this quote from Secretary Kennedy: for too long, families have been left without answers or options as autism rates have soared. Now, that's probably a true statement. We don't necessarily know how to address that, but that's probably true. Today, we are taking bold action, opening the door to the first FDA, so that's Food and Drug Administration, recognized treatment pathway, informing doctors and families about potential risks, see the word potential here, and investing in groundbreaking research. So it's research, it's not cures, it's not answers. We will follow the science, restore trust, and deliver hope to millions of American families. Okay. So that's what they're saying they're going to do. And I'm not saying I agree with any of that. I'm neutral. I just want everyone to think about what they're really saying. And these are the things they all agreed on, which may be more narrow than some of the other things we're hearing.
One of the things about what you said, Joy, though, is, and I've heard a lot of people say, is that when they say that the number has grown, which I know that's not really um, what you're pointing out about the whole thing, but is that people have talked about how much the definition has changed and expanded. So some of it is that even when they initially introduced the idea of autism and Asperger's, because we had both at the time, and they haven't even considered the fact that they've merged those. So, of course, that would make the actual diagnosis of autism to grow as people started saying, well, we're not going to consider these people as having an Asperger diagnosis. Everybody's going to fall under autism. And that we've kind of expanded and looked a little bit more. And now we have these different classes. So you have some people who start getting a diagnosis that initially they wouldn't have gotten one, but it didn't mean that it didn't exist 20 years ago.
Right.
So anyway,
So
I'm just
there's
going to
Yeah, there's a lot of different reasons why all these things could be true, if they are true. Yes. Okay, Shayla.
I was gonna say, I don't like whether we agree with the study or not, I don't think we're getting like an accurate picture if you don't think about it, because years prior to, I want to say 2000s, like the late 90s, 2000 is when people kind of realized like, hey, there's something going on with our children. And then mental health kind of came to the forefront of like, this is like part of like development in your child, and having a good mental stability can like help you go further in life, and kind of just took off of
Mhm.
like having better support systems for people with mental, I don't want to say mental disability, like, but mental difficulties at times.
Mental health challenges, maybe.
Yes, mental health challenges. So the numbers are going to look drastically different in the 2000s versus like the 1960s, where like that wasn't a thing you just did.
Yeah, so we need to look at all the reasons for sure. Okay. All right, so this is the first thing that they tell us we're going to do. First, the US Food and Drug Administration will act on a potential, it's not saying it's a cure, a potential treatment for speech-related deficits associated with ASD, which is autism spectrum disorder. The FDA today is publishing a Federal Register notice outlining a label update for, and I'm probably not going to pronounce this right, leucovorin for cerebral folate deficiency. And then this goes on to explain that there is a small group of children, and I probably should, I'll encourage everyone to just read this, that have speech delays, that have this deficiency, that also have been diagnosed with autism. So this will make that drug easier to cover, I think is saying. So the change will, let's look at this paragraph. The change will authorize treatment for children with ASD with continued use if children show language, social, or adaptive gains. So if this medicine is tried for them and they anticipate it's a small subgroup of children with autism, this change will allow them to continue to get that medicine, and the label for that medicine will be updated, and so state Medicaid programs can pay for it. Okay. So that's one thing they're saying. Now, one thing I went and looked at is they do have a link to a study that looked at that drug and using it. And again, this is for a small group of children who also have autism, who appear to have this deficiency in folate. And this drug helps folate get to their brain where it's needed, from what I understand. This study, I'll just point this out, was a meta-analysis, which means it looked at a whole lot of studies on this topic to see what they said. It was done in, I think, 2022. So, or 2021. So it was not done in the current administration. So that's just something to think about. So that's all they're saying is a small group of children, they'll be authorized to get this treatment. And then look at this paragraph. While promising, it is important to note that leucovorin is not a cure for autism spectrum disorder and may only lead to improvements in speech-related deficits for a subset of children. So they're saying this may help some children. Okay, so that's one thing. And I encourage you to look at this whole thing. All right, here's where they start talking about Tylenol or acetaminophen. See where this says second? So the first thing is looking at that drug that might be able to help a small group of children with speech. HHS, and that's Health and Human Services, will act on acetaminophen. The FDA, so that's the Food and Drug Administration, will issue a physician notice and begin the process to initiate a safety label change for acetaminophen, which is Tylenol and similar products. So they're going to put something on there that says, you need to be careful with this in these circumstances. And there will be a nationwide public service campaign to go along with that. All right, then let's see what they say about it. The FDA is responding to prior clinical and laboratory studies that suggest a potential. So it's not saying there is one, it's saying there's a suggestion of a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes. So they are saying that there could be a potential association. This press release does not say Tylenol causes autism, although some of the other things that have been said publicly are much closer to saying that. So I would encourage you, like if you're talking to someone, to say, let's look at this. These are the things, this is the public statement they put out that everybody in the White House agreed on. Then this is in there. The FDA also recognizes that there are many contrary studies showing no association. So it's saying, yes, we know there are studies out there that don't show an association, and that there can be risks for untreated fever in pregnancy, both for the mother and the fetus. So they are saying in this press release, we recognize that this is not known. We think there may be a potential connection, but there's other studies that don't support this, that say that's not true, and that there's also risks for untreated fever in pregnancy. So given the conflicting literature and lack of clear causal evidence, so they're saying there's not evidence in this press release, and this is from the White House. HHS wants to encourage clinicians, so that's the doctors who are and nurse practitioners who are treating patients, to exercise their best judgment in the use of acetaminophen for fevers and pain in pregnancy by providing the lowest effective dose for the shortest duration. So when somebody does need Tylenol, if the doctor says, yes, you do need it, use it for the shortest amount of time, the least amount to get the effect you need. I'm not defending this. I'm not critiquing it. I'm saying that what's actually written down here may be different than some of the things that have gotten said, and may really be different from some of the things that people have heard got said. Now, there were a lot of things said at that press conference. Okay, and then it's it talks more about the folate, and it says third, NIH today is announcing the recipients of the Autism Data Science Initiative, funding 13 projects totaling more than 50 million to transform autism research. And who was one group we said definitely needs to be at the table to look at any kind of research? And that's right there in the definition of family-driven practice. And that's families. Okay. And it's talking about integrating large-scale biological, clinical, and behavioral data with exposomics approach that I don't know that much about, that examines environmental, nutritional, medical, and social factors alongside genetics. Because one thing this administration has said is there's been too much emphasis on just trying to find a genetic cause and not looking more broadly. So that's what the press release actually says. And then this fact sheet. gives more details. Okay, so any thoughts about that? Okay, I'm going to put the links to these in the chat. So I just put the link to the fact sheet in the chat. And then here's the actual press release. Okay. And you guys were very right. You were bringing up, but there's got to be a way for families to give feedback. Now, there is a link at the bottom down here. And it says it's for media, but let's look at it because it's submit a request for comment. Oh, it's only letting the media do it. Okay. So that's not going to work. All right. Okay, let's just pause there for a minute and then we'll look at a little bit at what actually got said at the press conference. Any thoughts after looking at those? And I'm not trying to lead you in any particular way, but when you look at those, does it give you any different impression, whether you agree with them or not, of how this issue has some of the other things you've heard about this issue? Any thoughts on that? Do these seem the same as what you've heard? Different? Anything surprising? Y'all are quiet group. When I read them, they seemed to say less than what I'd heard. Because I didn't see anything about definite conclusions, about Tylenol causes autism. I saw that that was something I wanted to look at more, which still I wondered about because just like somebody on here said, I thought back to being pregnant, thinking, but what else do you take? What do you do when you really need something? Okay. All right. So that's their press release. But another thing that's out there is the actual press conference. And again, I encourage everyone to go to what we would call the original source. Like if you say something and somebody disagrees with you, let's say you've written down what you thought and then you talk about what you said. You would probably, someone who's concerned about what you said, you'd probably rather them go to what you said or what you wrote than what people said about what you wrote. So I encourage us when that information is available to do the same thing. Now, This is a link for the actual press conference where they talked about this. Now, one thing that happened, well, I don't know if people knew that that written press release was out before this press conference. I can't remember how that happened. Let me put this in the chat. This is the actual press conference, and we're not going to listen to it, but I just want you to be aware that it's out there. And I want to call your attention to some things. First of all, you can start it. I think it starts like they never start right. Like at the 4-minute mark. But these were some things I noticed as I watched that I'd encourage y'all to think about. First of all, well, I'll ask you guys this. There are, who all do you think might have been there? We have the president. Who all do you think he might have had with him? This is such a quiet group today. I thought people would have really strong opinions about this. So he had people from his cabinet. He had Dr. Oz. He had RFK, who is not a physician, who's an attorney, who's over all of Health and Human Services. And then Dr. Oz, who's over the Centers for Medicaid and Medicare Services, and the head of the National Institutes of Health, I think is a position, some other people. He also had 2 moms there of children who have autism, one who has he's severely involved and one whose symptoms are I guess what we call milder and not as affected as far as their day-to-day ability to function. So my hat is off to this administration that they had parents who spoke at this conference, at this press conference. And I think one thing that tells us as far as being family driven, we know families are at the table. So we need to keep doing all we can in reaching out to policymakers and to the White House to make sure as many families as possible are at the table, including families who may not. If all families don't agree on this issue, then whatever the range of perspectives is to make sure that range is represented as well as possible. I'd also encourage you all, and I'd encourage everyone to look at the press conference, but as you watch it, I'd encourage you to think about, well, we have the lived expertise of families in the room. So that's probably the most important thing there is what they're telling us. And also that shows us that this administration has opened the door to families being at the table, which is very consistent with family-driven practice. So we need to use that opportunity to make sure as many families as possible are able to give input on what should happen next with these things, especially that research. I also noticed that the physicians who spoke at the press conference, their remarks seemed to be most consistent with the press release. They didn't go much beyond, for the most part, they didn't go much beyond that. So I'd encourage you to think about that as you go through. So, and that just kind of makes sense. If they have training in this specifically, that they'd have that perspective. And then President Trump made quite a few remarks in this press conference. And some things I noticed that I'd encourage you to think about. He himself says, I wrote down some of the things he said, and now I'm probably not going to be able to find them in my scratchy notes. But he says things like, I'm going to go beyond the group. I'm not going to wait for the studies to come out. And he talks about that this issue is really important to him, and he's wanted to do something about it for a long time. So we've got that enthusiasm, but we also have him telling us, I'm going to go beyond. I don't want to wait. So we have someone who's very excited and going beyond what is written. And you can tell because sometimes he's looking down and reading what he's being asked to talk about. And then sometimes he's just talking. So, and he's the president of the United States, he can do that. But as you watch, to keep in mind, what is he reading and what is he just talking about? And then there are some remarks from the doctors, like doing this in partnership with families. There's comments about consulting with your own doctor. I thought this was one of the most profound comments I heard, and it was from one of the moms. And I think it's at about 34 minutes right after that. She said, unless you have lived with profound autism, you have no idea. And I thought that's probably the most family driven thing anyone could have said or demonstrated. And hats off to her for making that clear and really representing not just her voice, but that of a lot of families. I would encourage everyone to look at that, to watch that press conference, and just keep those things in mind. Who are the experts in the room? When is President Trump sharing the written information that everybody agreed on versus when is he talking about things that he personally feels very passionate about? And again, everybody has the right to do that, but the way we weigh those may be different. So those are just some things to think about as a starting point, and in discussing this with other people, maybe sharing what's been written, encourage them to think about what are the types of expertise they want to listen to most among this group, and then what about what we're hearing is based on the written statement that's out there versus things that one person or several people might feel particularly enthusiastic about. So any thoughts? Y'all have been so quiet. Are we on track?
I think it's a lot to think about.
It's humongous. And I also think anytime something, and this is controversial, I mean, people are just either saying, oh, thank goodness this has finally been said, or I'm totally up in arms. Anytime there's something that comes out that's controversial, it's very easy to, because it's hard and it's uncomfortable to just cling to our side and think, well, I just want to stay over here. And, you may think about all this and that's exactly what you end up doing. And that's maybe what I do. I don't know. But to realize that's a characteristic we all have. And there are ways to look at this information and what was said and maybe a little bit more objectively evaluate what it means for us and our family that doesn't provoke quite as strong of emotions. And also we're talking about a president who, both for people who really like him and for people who don't like him at all, he seems to evoke really strong emotions. So it's kind of hard to separate from all that too. Any other thoughts? But you're right, it's hard, Jackie. Okay. Is there anybody